Yesterday, while researching, I came across an actual academic paper that talked about an ancient Indian practice of lengthening the penis. Really, and I had to tell you all about it. So in the Kama Sutra, there is a mention of something called sukha, wherein ancient Indians used to use insects to artificially grow the size of the penis. And so many years later, nothing has changed because the society is still obsessed with increasing the size of the penis. Today, we're going to talk about that and so much more. But before that, welcome, you're watching Allo, Ask the Sexpert, a space where we invite sexual health and wellness experts, aka Sexperts, to talk about sex, pleasure, wellness, and so much more so that you can have better sex backed by science. I'm Artika and I'm really delighted to welcome again Sexpert Dr. Deshpande, who was here with us when we discussed penis size the last time. Hello sir, how are you doing?
Thank you. Happy to be back, and I'm glad that we are discussing this topic again.
Yeah, I mean, we discussed it just a few episodes back and we got so many more questions that we had to pick up those questions and we felt like we had to talk about it with you again.
All right.
Great. So I think, we have talked about does size matter in the past. Now the question is still about lengthening the size of the penis or increasing the size of the penis. And we do see a lot of ads, right? Like all over the internet, we'll see ads about pills and potions and lotions. So just starting from there, do they work? What's the truth?
They don't, unfortunately, for all the huge industry that exists out there. There's a very small percentage of people who actually need the penile lengthening.
Right.
We spoke about micro penis, just so that I can, refresh memories.
Yeah.
A penis length on erection that is less than 3 inches, measured from the base, which is the pubic hair, to the tip of the penis, would be called as a micro penis,
right.
less than 3 inches. So a person who has that condition might want to go to a urologist, get himself evaluated, and then consider going for a surgery.
Right.
Then there are some conditions which we call as congenital anomalies, being born with a defect.
Right.
So it could be a defect in the shape of the penis, the scrotum. Some men have penises which are buried inside the scrotum.
Right.
It gives the impression of a very small penis. So those are the people who need the treatments. And the treatments there are largely surgical.
Right.
So the surgeon will decide, the urologist will decide how to go about, explain it to the patient. And commonly they remove a pad of fat.
Yeah.
They have some transplants from different areas of the body that are done to try and get some extra skin. So they are not for everybody. Unfortunately, the myth and misconceptions that are going around is the use of weights, is the use of pills and potions, as you called it. Not required, really.
Yeah. So just so we have it on record from a doctor, the pills don't work.
They don't.
So you don't have to listen to me. This is an expert saying it. But no, yes, of course, starting from there, I think you talked about a lot of medical conditions. And right now in the world, we are seeing the cosmetic surgery industry grow in a big way. There are all sorts of enhancement surgeries for different body parts. And talks about the penis enhancement surgery also do come up. So who should really be getting it? You mentioned a few medical conditions wherein it may be required based on, of course, evaluation by a doctor. Other than that, do you think there's anybody who should be getting it just for cosmetic reasons?
That's a bit of a controversial question as well as a gray area in medicine.
All right.
There are people who are preoccupied. They worry excessively about their bodily appearance. There is a condition called bodily dysmorphophobic disorder.
Right.
You must have heard about people going for nose jobs.
Right.
They believe that their nose doesn't look ideal, and they're constantly worried about it. So we have a similar condition where men are concerned about the size of the penis, but it has to be carefully evaluated.
All right.
If it is a case of being ill-informed or not informed at all about normal sexuality, because what's happened, Artika, is most of the sexual education, so to say, is currently happening through the internet.
Yeah.
So when they look at big penises, when they look at men who are able to continue to have sex way longer than what is normal, and most people don't know that there's a lot of editing that goes in making a clip of porn.
Yeah.
They are the people who are misguided into believing that they have a small penis.
Right.
I guess in those people, counseling and therapy will do them a lot good, not surgery.
Yes. Rather than a surgery. Absolutely. Absolutely. And I think just picking it up from what you just said, we understand now that a surgery is not medically required or even recommended in most cases. But what is even the point of wanting to increase the length of the penis? Does it help in any way? Does it have anything to do with pleasure, or it is more of just a societal norm thing now? How do you feel about that?
Well, women were asked this question: does it really matter how long is the penis? How long he is able to carry on with the act of sexual intercourse? And we know through data and research and anecdotally when we talk to patients and couples that the size really does not matter.
Yeah.
So in that sense, it's the men who need the education, that there are many other ways to pleasure their partners, and the penis is, not essentially the only way to get it. Yes.
Yeah. I mean, I think this is also just touching a little bit upon personal insecurities that males might have. That, when we say that the female partners are actually not bothered, then, maybe we should do some sort of poll at Allo and check the responses we get from the male respondents.
True.
So, again, I think you know the drill, but I do have some more questions from you which have been crowdsourced. And I'm going to ask them in the segment called Ask Your Question. If you have any questions, you can send them in anonymously. The link is in the description. Can I go ahead and ask you some?
Yes, please.
Okay. So the first question is, it's pretty simple and straightforward, but a really good question, I feel. How can I keep my penis clean? I think nobody talks about this.
True, because penile hygiene is very important.
Yeah.
We tell men that there are certain wet areas in the body. We tell this to women as well. I'm sure you would have covered it in the segment about female sexuality.
Yeah.
So those wet areas have to be kept wet. For men who are uncircumcised, which is they have a layer of skin called the foreskin, at least once a week or once a fortnight, they should try to roll it back till the ring-like structure and clean that area with warm water, not with soap, because soap makes that area dry. So that's one very important aspect of hygiene that men have to practice.
Yeah, and I think, that's so simple and you can actually do it, but I don't know if a lot of people even know about that.
Well, they know it now through
That's
Allo.
amazing, yes, through Allo. Okay, moving to the second question. I don't feel confident about my body or my penis. What should I do?
So this is probably the gentleman who worries a lot about the size of his penis. I think he needs a dose of education and maybe a couple of sessions of therapy to try and help him normalize the way he looks, the way his penis looks, the size of it. So he needs to understand that not all of us look the same, or not all of us have a chiseled nose. So he needs to be happy with the size of the penis that he has. So a lot of education, I think, needs to go to this man.
Absolutely. And I hope the person who's asked this question has heard this and, this answer helps them in some way. The last question for the day that I have is, my penis hurts a little bit during sex. What could it be?
Now that's a very good question. Again, little is spoken about this as well as discussed. There are 2-3 conditions. One, men who have a tight foreskin, the foreskin that doesn't roll back, they can, during the act of intercourse, because of the friction, have the skin that gets pulled back, and that becomes painful.
Right.
So that condition is called as phimosis.
Okay.
So they need to see a doctor, preferably a surgeon or a urologist, who will examine it, confirm it, and where necessary, minor surgical procedure called circumcision is done. The other condition where men can complain of pain is if they are having any infection.
Right.
So commonly we talk about STIs, sexually transmitted infections. So they must get themselves evaluated if they have noticed any lumps or bumps on the penis or in the groin area, or if they are having any kind of discharge from the penis when they are not passing urine, if they notice pus or any other discharge coming. So that's another condition where you can expect pain. The third one, less spoken about, is something that is normal. So when men start becoming sexually active and have intercourse for the first few times, they are not quite used to the sensitivity on the tip of the penis. We call it as the sensitive glands. So they need to be educated that it is pretty usual, normal, and to overcome that, we at Allo have developed a technique called the desensitization, the glans penis desensitization. So they are encouraged to use those steps and to overcome that discomfort. Hope that answers your question.
Yeah, it does. And thank you so much for sharing that. I think also just a reminder that, again, when it comes to penis hygiene and health, there are a lot of inhibitions. Like, people don't come and ask these questions. And I'm so glad they've been asked, because now they'll be addressed. And that's exactly what we're trying to do at Allo. That also brings us to the end of this episode. And I have to mention that I think the length of this episode was shorter than the last one. But it doesn't matter because we got the job done.
Is that a pun intended?
It was. So thank you so much again for sharing your... Size doesn't matter. And thank you so much again for being here.
Sure. Always a pleasure.
Yeah, and everybody else, again, if you have any feedback for us or want to talk to us, you can talk to us across all the channels, Instagram, Twitter, in the comments below, or even write us an email. So we'll be back again with another topic and another expert. Until then, take care and goodbye.